If you're suffering with lower back pain when you're bending, there's a number of different structures we need to be looking at, maybe addressing, and also be potentially concerned about too. So let's have a look at what those could be. When we look at a typical spine and your lower back, we've got the front over here and the back here. It's certainly not as big as this model here. Now what we have is we've got the bumps on the back, which you can feel on the back of your back, just there on your spine. And these spaces between, these are all the joints. So these joints allow some movement through there. Also between those bones, we've got these discs. So those will be spongy, shock absorbing discs to absorb any shock that might be occurring from any movements. So when you bend forwards, one, those discs could squish, so that might be causing a bulging in the disc and it might pinch any of the nerves that come out of the spine. Or it could be where, when you're bending forwards, these joints, the facets, they're called facets. So they have a capsule around there and they might get overstretched, meaning that therefore they're getting so much pain because they're working too hard at those levels. So that might be causing some pain or discomfort too. Or if there's inflammation around there, that inflammation may also, just like how the disc bulge pinches on those nerves, that inflammation could also pinch on those nerves as well. We also have some other tough ligaments around that area. So again, bending forwards just through your back might also overstretch some of those ligaments and then can also cause pain. And of course, we've got muscle fibers running around this area too. So if you've got tight, weak muscles, any bending movement may aggravate any weakness or pain in that area as well. So there's, as you can see, a number of different things that may cause pain just from bending forwards in a mechanical fashion. And so we need to think about how there's not just one type of exercise or a bunch of exercises that we can give you just to cure that back pain, because back pain isn't a disease. So you can't cure something that's not a disease. See, back pain is a symptom. So there's a number of different reasons why you can have back pain, which is what we just gone through there. And so we need to consider what are those things that happened. Now, what you can do, and what a lot of our patients do, is when they have aggravated back pain, they'll often find they're moving a bit more gingerly, they're moving much more carefully, and actually in most of the cases they're moving more correctly because they're now bending their knees to reach for things. And we need to remember that, because that can be very quickly forgotten once they're feeling better. Then actually, maybe I can get away with bending and reaching a little bit further than I'm used to, and then again going to be back to square one. So bending when you've got lower back pain, or when you don't, make sure you're always using your legs, because you've got larger, stronger muscles in your legs, and they're much better equipped to be able to hold you and support your movements and function, rather than the smaller ones, obviously not in this model, but your smaller ones that you have actually in your spine that are not designed for that movement. Hope you found this useful, and please do make sure you share this and also tweet me and DM me as well. I'd love to hear from you. Thank you.